I am VJ Slate, and I am 59 years old.
My name is Julie Klein.
My name is Regina Richardson.
I'm an older mother, meaning I'm in my 50s, but I have a 4-year-old. I have adopted a child.
I'm a former professional athlete, C-level executive, mountain climber, marathon runner, all of those sorts of things. Never drank, never smoked, had none of the indicators, rather to say, that would indicate that I might have a higher degree of possibility for throat cancer. And I got it anyway.
I like to think of myself as just surviving, because that's what we do on a daily basis.
My name is James Justice. I'm a cancer survivor, and also I'm living with cancer currently. I'm also a very frustrated healthcare consumer.
We didn't go through this in vain, but somehow the roadblocks and the problems and the frustrations that we went through can somehow lead to maybe one person not having to go through what we went through.
Used to do a lot of, things that were enjoyable in my life. I used to like gardening. I enjoyed taking care of my family and entertaining. My name is Dee Ripple, and the things I used to like to do are different than the things I can do today. I had 2 wonderful jobs that I lost because of my illness, and my whole world has changed completely upside down. With the breast cancer, I had to receive 16 rounds of very, very, very intense chemotherapy. I unfortunately was abandoned by my family, so I had to walk the entire journey by myself. I'm fighting a battle every day for my life. And I think sometimes that people lose sight of the fact that it is such a destructive disease. You never know. You always live in this fear that the cancer is going to return. Cancer is all about loss. You have lost everything. You have lost everything that you once held dear. Your family sometimes, your friends, your jobs, your health, obviously. It's just all about a whole series and line of losses, and that makes it very, very difficult.
It seemed so preposterous that I would have throat cancer. I mean, it had none of the sort of variables that I thought were indicators. But when she told me that, my life stopped.
It was really hard. I remember somebody said, why are you depressed? You're gonna live. And it's like, going through cancer at 32 sucks. I have a right to be depressed. Another friend said, could you not say that C word around me?
I had heard from other people. I had heard some other people, like Michael Douglas, who had had throat cancer as well, that there was a very strong possibility he would be operated on, and if he was, there was a very strong possibility, depending on exactly where the tumor was, that he wouldn't be able to speak again. I'm a professional speaker. I'm in sales and marketing. Take my voice away, while my wife might find that, an amazingly wonderful thing to have happen, for me, not so much. So I was terrified when she told me. It was the scariest thing that had ever happened to me. And once I realized she wasn't joking by the look on her face, I asked her sort of the $64,000 question, which is, am I going to die?
It was depressing. I was more sick after the cancer was healed compared to during the time that I was going to chemotherapy, and I was actually nauseated and regurgitating, and I couldn't eat, and I have mouth sore, but I was more sick after all these symptoms are gone. Psychologically, I couldn't get out of the bed. I was depressed.
The life of a cancer patient, it's not, I don't think it really just is black and white. You don't go through cancer, go through treatment, and then you get this date where you're cancer free and you move on. It's not that easy. There's a transition period. For some people it's a year, for some people it's 6 months, for some people it's 3 weeks, for some people it's 5 years, you know. And I think that should be taken into consideration, because I think that's a very difficult time for a lot of us.
As bad as I thought it was going to be, just trying to imagine it, it was 10 times worse on every, emotional, physical, financial, you name it. It was an absolute disaster.
There's a saying that says, where there is a shadow, there is always a glimmer of light. And that is what we just look for in our lives, no matter how minute that light is. We look for it and we're grateful for it. So if you know somebody with cancer and you do something nice for them, just know we're very grateful.
I think the Affordable Care Act is an initial first step, good first step. It's flawed. It's flawed from a patient perspective because of the rising out-of-pocket expenses.
I had pretty good insurance. I mean, I'm blessed in that way, but it still cost us 6 figures to get through this experience.
For the first time in all my years and all my wife's years, this year we get to file our medical on our taxes because we have so much out-of-pocket expenses.
Even with decent insurance, which I believe I have, and I'm grateful for it, there's still so much out of pocket.
Emergency room visits, doctor offices, doctor visits not covered by insurance.
They were sending me bill after bill. I mean, I had stacks and stacks of bills.
And when you go to a specialist, it's $50 to $75.
When you have medical issues, it's not just the one medical issue, but it affects your work schedule, having to have arranged transportation. It's a lot of hassle.
Radiation was $27,000 a month, and it goes on and on. It's just, they call cancer a catastrophic disease, and rightly so, because it is a catastrophe in your pocket, in your life, in all ways.
Knowing that I didn't have unlimited funds, knowing that I was digging a hole between not working and the additional costs for my family weighed on me tremendously. And thinking that maybe, depending on how long it continued and depending on what the amounts were, that I would saddle our family with hundreds of thousands of dollars in potential debt in order for just me to get the benefit, was a very hard decision.
They should pay something, but they shouldn't go bankrupt and put their family in long-term financial distress in combating a life-threatening disease.
You have patients who need ongoing chronic care, attention, support, physician interaction, who are making decisions to not comply or making treatment decisions because of their out-of-pocket expenses. I've said before that it's the next crisis in cancer care. It is the crisis in cancer care.
Because of the out-of-pocket expenses being so much, we've been unable to do a lot of things that we would like to have done. We used to go out to movie and dinner once a week. Now, if we do it once every 2 months, we're lucky.
For someone in my situation who is not a traditional student, who's age 34, going back to school, not working, and now with a cancer diagnosis, it's a matter of, well, should I go back to school? Or do I need to start paying my medical bills and work and just go back to teaching?
Okay, what doctor can I put off seeing because I don't have that $75 copay, and which doctor's more important? But then you sit down and realize they're all important. So how do you distinguish between the ones that you should see?
I started a quest to find holistic approaches to my healing because I'm broken in a lot of ways, and there is holistic healing out there, but it's not covered by insurance, and it's very expensive.
And then each time I go to the doctor, some doctors say, well, if you're a Medicare patient, I don't take you. But then I said, I'm a Blue Cross. You used to take my Blue Cross. I said, but you are primary, so I can't take you primary Medicare care. So I have to pay out of my pocket, or I have to give up some doctors because of that.
When I had the colostomy, I could only get 30 bags a month, which left me 1 bag a day on the good months that had 30 days. On the bad months that had 31 days, I either had to make a bag last more than 1 day, or I had to buy extras, and those cost about $50 for a box of 10.
When somebody's sick and you're trying to focus on healing, the last thing you want to worry about is, oh my God, how am I going to pay this? Who's going to help me?
We know that when there's a financial barrier, people tend to put off prevention sort of at the top of the list. Doesn't seem urgent.
There's a problem with cancer patients who have serious illnesses and serious conditions and comorbid conditions. When they're faced with a decision whether to spend $6,000 plus every year for the next 3 or 4 years of their chronic condition, and they don't have the existing resources.
Take a look at the whole patient. You know, if you're a lawmaker, don't look at just one little part, because the truth is, it's a person's life you're dealing with, and every single part will either help cure it or not help. And why would you deny help to someone who's literally fighting for their life? Makes no sense.
The waiting period was so long. Like one time I had an oncologist appointment that was at 10 a.m. I didn't get seen until like 1 o'clock. So to sit there for hours and hours, and I was just looking at some of these patients that were way worse than I was, that had to sit there, and I thought, this is ridiculous. You shouldn't have to sit for hours and hours when your appointment's at 10 o'clock.
As we move on, payment reform models are not just about paying a provider. It's about enabling a patient to make decisions that are not purely financially based.
What I found is that I've fallen into the trap that a lot of people have fallen into, in that they don't get prescriptions filled, only take certain medications like once every other day instead of every day.
I did choose a doctor in Los Angeles because it wasn't offered in my hometown. What that meant to me was that I had to travel 3 hours to the hospital, needing to find a place to stay.
There were times when I probably didn't go for that PET scan when I was supposed to right away because the cost.
People are making decisions like consumers for in a situation where the stakes, the clinical stakes, and the potential suffering of patients is substantial.
I actually declined to go through chemo this time. And it wasn't the only reason, but part of the reason was financial, because it would have been, bam, another $9 grand. I'm self-employed, sole providing, and I didn't have $18,000 just sitting around to pay for treatment.
Some medications I could take to improve my quality of life, I just don't take because of the expense. I would say that right now I have quit taking medication that out of pocket saves me $500 a month.
I had a string of 3 patients during the month of January. 2 of them ended up electing not to have therapy. It was striking. It was striking.
When you have to make a decision whether you're going to have a drug or you're going to eat, it's horrendous, and that shouldn't even be on the table. Cancer is a very consuming disease for people in terms of getting treatment, in terms of making them confront big questions in their lives. And they should be focusing on getting the best care and spending time with their family, and not having to go in and out just because it's more remunerative for a doctor or a hospital. This seems to me a conflict that we can all agree should be solved.
Even I starve to death, I will not let go of my insurance. That's my life.
It is a big burden, and it takes a lot of time to navigate through all this. It gets kind of crazy because you're looking at this massive kind of matrix, and you're trying to find a way to understand, really what is your maximum out-of-pocket going to be, and the co-insurance and that kind of puzzle. I had to work through all these different choices, and that's really challenging. I don't know if you've ever done it, but I think there was some frustration over sometimes the plans look so similar.
Once the whole Affordable Care Act went into effect, I had to switch from the PCIP plan into the Affordable Care Act. The Affordable Care Act for me has meant saving a lot of money. My monthly policy has gone from $505 a month down to $136 a month. My out-of-pocket has gone from $9,000 to $2,500. However, I've made appointments with doctors only to have them call me back later and say, oh, we don't take your plan, we take other plans.
Just 2 months ago, it was all good. I had insurance, I was paying, it was reasonable, and now somebody made a change in this, and the geography changed, and I can't go downstate. I can't go to that hospital. I currently go to Albany, drive about 40 to 50 miles to go see my doctors.
Right now, nobody knows who's taking what, and there's not consistency across the board.
The organization, the plan that I had prior to ACA was still offered under ACA, but they changed it, they altered it. So it was the same insurance company and very similar coverage, but it didn't cover downstate anymore.
They said, you're still the same insurance. I went, oh no, as a matter of fact, I'm not, I'm now Medicare. And they went, geez, Lee, I don't know how to tell you this, but we don't accept it. We accept your insurance. I said, well, but it's secondary. And they said, that doesn't matter.
It is kind of nerve-wracking to have to reestablish relationships and go through all the history, and you wonder whether or not the doctors really read your file. I really feel like a key part of all this is that you have a relationship, with your doctor and the team. And I said, is it possible if I had a recurrence, would I be able to go back to my doctor down in New York City? And the answer wasn't no. The answer was that I could get a quote-unquote hearing if that situation were to occur.
Unfortunately, this is kind of the times we're living in right now, that it's happening more often than not, where a medical plan may be inhibited or have numerous roadblocks because of insurance issues and coverage issues.
They had a good choice of plans, but the one plan that I really wanted, which was what I had, but a new version on the ACA, would mean that I could no longer go to the doctor that initially treated me.
I live in a remote area, and he is the only doctor in that area that does the type of surgery I'm going to need. And so what it's going to mean to me is I will probably need to travel to Los Angeles to have my surgery done here, which I'm willing to do. But I've had a history with him for many, many years.
It's hard to lose doctors. I mean, one of them I was a patient for 14 years. I mean, this was someone that I knew his family, I knew him.
The type of cancer I had, I've gotten a very good trust in the gentleman and all his nurses and stuff. And to change and have somebody else doing it, it's very upsetting.
I didn't have a choice. I had to find another doctor. It was wrenching. It was hard. It was disappointing. It was angering. It was not what I wished had happened, for sure.
I really feel like a key part of all this is that you have a relationship, with your doctor and the team.
When patients do get a serious illness like cancer, having the option for them to go out of network for a consultation and second opinion to reassure them that they are getting the best appropriate care, I think is something that ought to be built in, where that second opinion is not at a stratospheric out-of-network copay.
You can spend the time with the patient explaining why a treatment plan makes sense, but only to find out that this is going to take a little bit more work from an insurance perspective. In the meantime, the patient's disease remains untreated. So everybody's time is very important, especially the patient's time, actually.
It's perplexed me why insurers have not built those in to their narrow network products to have what I call a safety valve for people who are sick.
That to me is just not okay. It's just not okay. If we can't, if we can't care about our fellow man more than that, we got bigger problems to worry about.
I would give advice to people making laws. I would say that they really need to sit down and think about people.
I think that politicians or people that are making law in Washington, D.C. sometimes get blinded by what the paper's saying instead of what a human being's going through.
Here's what people really want and need, and not just in cancer care, but in healthcare in general. They want to be engaged by a physician-led care team. They want to have access. They want education. They want understanding. They want to be involved in the decision-making.
Patients actually care about things like, are their symptoms being evaluated? Are they getting actually back to work, or is the chemotherapy and the management of symptoms actually requiring that they take time away from work and other social activities? That kind of measurement, how much time are you actually laid up, is also very important.
We should have the voice on what it's like to go through cancer and to lose your financial stability because of it.
Who better to give that perspective? Not people who are looking at it from the outside in, but people who are actually in the cauldron and trying to make sense of it. I mean, that's where the insights come from, not from people who think they know what it's like, but people who actually live it.
Our leaders need to really listen to people. They need to really get out of their shell and get out of their offices and have a dialogue with patients, with survivors, with their families.
I think if we change our focus more towards what a patient needs overall, we can kind of develop a policy that would really benefit everybody.
The reason why people think it's so chaotic right now, you have physicians that are burdened because of lack of standardization of process and lack of data because of unstandard processes. And then you have patients who are burdened with high out-of-pocket expenses. So both sides are suffering.
And one of the big challenges has been to get quality metrics that everyone agrees are meaningful. In cancer, we can't wait for 5 years to find out, compare overall survival rates. So we need some process measures to assure everyone that patients are getting quality of care. We need to shift from doing more and testing more and giving more expensive chemotherapy and seeing patients more frequently to assure doctors a margin, to focusing on what is important for the patient and what is the right treatment for the patient. And that requires a change in the kind of incentives we provide and how we pay for cancer care. It shouldn't be paid for doing things, it should be paid for caring for patients.
People are people, they're not numbers, they're not statistics, they're not votes. We're all human beings. Listen to cancer patients, find out their needs.
I'd be happy to sit across from anyone, no matter what side of the political spectrum they were on, and have the conversation of whether or not they think my life was worth saving.
Cancer is really winning this war. No matter what the doctors and NIH is doing, it's still winning.
But we have to take care of our own. And what more important time than when they're sick? That's when they're the most vulnerable. That's when, if the United States has a care as a country about the people that pay the taxes that get spent, I can't think of a better place to spend those dollars than on their health.